In today's video, we're talking about second opinions, third, fourth opinions, and the medical system. We're talking about how to advocate for yourself in those appointments and using it as information, not just as a, this is the opinion and this is what you got to go with. You want to be able to weigh your options. So today we're talking to Dr. Mark Schultz. He's a 30-year medical oncologist who has focused his career solely on prostate cancer. And we're going to find out from his perspective how to advocate for yourself in those doctors' offices. So in today's video, we're talking about second opinions, but we're really talking about conflict of interest when it comes to second opinions. There are so many patients who walk into the doctor's office, they find out they have cancer, and they're so vulnerable because of the emotions and the mental load of just finding out that you had cancer. And then sometimes you have someone come in and say, okay, we can schedule for surgery in 2 weeks and I'll walk you out and make your appointment with you. And patients, don't really get all of their options up front, even in 2025. So there's a lot to talk about when it comes to this because there are different types of prostate doctors. I don't think a lot of patients realize that. I don't think patients realize insurance will cover a lot of these different things, and there's just so much to educate on in this space. So let's just start off with maybe the typical situation that a patient would find themselves in, who they see, and we can go from there.
The basics of prostate cancer for decades has been urologists or surgeons who's done a random biopsy on someone who now has been told they have prostate cancer of some ilk. There's different grades and stages. The challenge, of course, for patients as they enter into this sudden I have cancer world is that they have to parse through the fact that it's a big business and there's a sort of an agenda, 200,000 new cases every year, and the doctors are thinking in terms of, okay, now we got the biopsy, we have the cancer, now we do the surgery. They realize that patients are, emotionally back on their heels and in shock sometimes and looking for direction and comfort. Doctors are very comfortable in this space, whereas the patients are very uncomfortable in this space. The challenge for patients is to take a step back, and we've emphasized a lot on this channel in the past. Don't go for the first option that's offered, because each doctor that you visit in this process is trained in a specific type of treatment. Traditionally, they'll position themselves as being there for you to offer you options and help you see what's advantageous for you, but honestly, that is just a sort of a soft sell to create a comfortable relationship with the doctor and a trust so that ideally you end up doing what they want. I don't want to imply that the doctors don't want the best for their patients, but they see the world through a lens of what they do. And it's very natural that they're going to want to do or feel that what they do, whether it's surgery or radiation, is the optimal thing. And there's so many different factors that patients have to consider when deciding if that really is best for them.
That is so true, because when a patient is walking into this office and they're talking about treatment, they are not really thinking about, I think oftentimes they're not thinking about the side effects and how extensive those can be. With radiation, you have short-term and long-term side effects. With surgery, you can have, permanent impotence and permanent, incontinence issues. And you can have issues with both, but you really have to weigh your options. And then there's different types. You hear things about, nerve-sparing surgery, and then you hear things about, different types of radiation, and there's a whole host of different types of radiation, and really you see these titles and you don't really know exactly what they are. Are they the same as the other ones? Are they different? Which one has the best survival rates? So with all of this, having to educate yourself can be overwhelming, but I think that's why it's so important to know exactly what type of prostate cancer you have. So that really helps you in your appointments, talking to your doctor. But how do you kind of get that confidence besides, education? Is that really the only thing? Is there anything else to educate yourself on so that you can have confidence to tell a doctor, hey, I love that you gave me this option. I'm going to go talk to this guy, and this guy too. Full respect to you, but I want to make sure I know my options.
Using physicians as a resource for information, rather than delegating the ultimate treatment decision to an expert. This is something that's very different about the prostate cancer world. If someone's coming in with a new diagnosis of leukemia, we're not going to be shopping around for opinions about what to do. There isn't time. Leukemia can grow extremely quickly and it's very deadly. So you put yourself under the supervision of a qualified expert and you do what you're told. Prostate, for those that are newly diagnosed, is a very slow-growing process, and the decision about optimal treatment is more of a long-term strategy for your life. These diseases, these prostate cancers, even the higher grade ones, take a year or more to spread. Typically, if you look at the medical legal responsibility, if there's been a delay in diagnosis, if someone had a 1-year delay in diagnosis, the doctor would not be culpable because the outcome would be the same. This prostate cancer space is very different, and because of the sensitive location of the prostate near urinary and sexual and rectal function, and the difficulty of treating the prostate in that region, it's very logical to balance quality of life issues, trying to, yes, deal with the cancer and eradicate it, but to do it with finesse and to do it with as few of side effects as possible.
One of the things that you mentioned is timing, and one of the most popular videos on our channel is how much time do you have to make these decisions. Can you just quickly, talk about that a little bit and why these patients have time to get second and third opinions?
There have been studies. Prostate cancer is so common that in the era when surgery was pretty much the only treatment, it was called the gold standard back 20 years ago. There were certain recognized experts that were better at it than other doctors and were less likely to cause impotence and incontinence. So they had huge waiting lists, and some patients were waiting for 6 or more months before they had their operations. Diligent researchers went back and looked at those databases to determine if those people who were postponed for 6 months had lower cure rates. And the cure rates were identical for those that had treatment within a month. It's not that we just kind of feel that prostate cancer is slow growing. We actually know it is unlikely to spread quickly because of these studies.
Before I get to my next question, I just wanted to remind you that we have an in-person conference coming up this September, and it's a great way to get your questions answered from world-renowned prostate experts. You can learn more at pcri.org/conference. Now, don't forget to click that subscribe button, because when you do this, it supports our channel and it gets our videos out to other people who need them. And also, if you would like to support us financially, you can do so at pcri.org/donate. Now back to my conversation about second opinions with Dr. Schulz. One factor that you have mentioned, and it was really enlightening for a lot of patients, including myself, and you wrote this in your book, A Key to Prostate Cancer and an Invasion of the Prostate Snatchers, was talking about how much money is in the prostate industries and why there's such a push towards certain treatments and why you're kind of being sold a product even though it's a cancer-saving treatment because of how many treatments are out there and the fact that people need to pay for machines. So can you talk about, the intentions of the doctors, but also the fact that there is so much money involved in this process?
Doctors are in business and they want to present a friendly scenario for people to select them to be the treating doctor. But prostate cancer is very common, and as we all know, there's not an excess of doctors, so these doctors are making a good living. The financial urgency is part of the story. I think part of the story is just the pride in their craft and that they really believe in what they do. They're sincere, but they're looking through the world with a specific viewpoint from their training. Sometimes there's a tipping point between someone who can simply be watched on active surveillance versus undergo treatment. And the doctors, you would think, well, they have an incentive to treat because they get paid. But I think the bigger incentive for doctors to treat is to free them of medical liability. Doctors are very comfortable with dealing with the side effects of treatment, and they've forewarned the patients, and patients sign away everything. And doctors are less comfortable with the idea that, well, if I watch this patient and I told them to watch it and then it spreads someday, how am I going to defend myself in court? They're not trained in doing active surveillance, they're trained in doing treatment. So they're not really familiar with all the probabilistic constructs, and therefore, I think there's also an incentive for both radiation and surgical doctors to nudge people towards treatment just because they know they won't end up being liable if something were to go wrong.
So we have the standard of mostly surgery and radiation, and then you need to go search out, different opinions. Can you walk us through the different types of doctors and the different types of opinions that one should get?
Well, I guess we could probably broadly divide it into the surgeons, the radiation therapists, and then you have new treatments that are coming up, like high-intensity focused ultrasound, cryotherapy. I shouldn't even call them new. They've been around, but they've never become mainstream. These other alternative treatments, little cottage industries that are outside the mainstream, but are an area of growing interest because of their potential for reducing the risks of erectile dysfunction and incontinence. So the surgeons, of course, the urologists, and then the radiation therapists are handling beam radiation, proton therapy, cyberknife, and different types of brachytherapy. There's a sort of a deferential attitude of radiation therapists towards the surgeons, because the surgeons are diagnosing the patients and they're steering these newly diagnosed patients where to go. You'll find that oftentimes radiation therapists are not pushing their methodology really hard if you've been referred to them by a surgeon. The radiation therapists don't want to offend their referring doctor, the surgeon. So be aware of that. There's a natural tendency to defer to authority and to expertise. And as I mentioned before, that should probably be the norm for some of the more serious cancers. When people are getting a second opinion for prostate cancer, I would say that you're seeking more new information than an opinion about what to do. It's important to learn what are the expected cure rates based on your stage and the type of treatment being administered. And I don't just say, hey, it's a good cure rate or a bad cure rate. I want a percentage. I think patients should also be querying these physicians that they're consulting with. What is the percent likelihood of incontinence and impotence and other potential toxicity? Because you have options. And if you don't have a clear picture of what the long-term side effects that you're going to have to live with for the rest of your life are likely to be, then I don't think you can make an informed decision. And I think it's unlikely you're going to be able to garner accurate information after only consulting one physician. This is why I think second opinions are reasonable if you look at them as a resource for information rather than finding the doctor that you're comfortable with so you can select a treatment. Once you've made the circle and consulted with a variety of different physicians, then I think it's reasonable to take a step back and make a decision about what type of treatment you want and who you want to have do it.
Well, that makes a lot of sense, because I think a lot of patients also kind of have a get it over with kind of mentality, which makes sense because it's cancer. You want to move on with your life. You want to get it taken care of. But that get it over with mentality can sometimes get in the way of giving yourself time in order to make sure that you're getting all of the information and weighing all of your options. One of the other things that I've seen happen with newly diagnosed patients is, we tell them, okay, do your research, get second opinions, get third opinions, go to major universities. They have a lot of really great doctors, find a center of excellence. And in some of those instances, I've found that those patients find a doctor who is talking to them. They're very excited about the treatment. And then when they go to do the treatment, they're finding out it's like a clinical trial and there's random needle biopsies involved. And there's a lot more to the process than just the standard treatment that would have typically been done. Can you speak to that a little bit, and just educating patients on another thing they need to be aware of is the fact that if you go to these universities, clinical trials is a big deal.
Right. That's really their claim to fame, is that they're publishing new research. One physician referred a patient to me, warning him that he didn't want that patient to be treated like a white lab rat. That the agenda at the university could be nothing more than, let's find a clinical trial that we can slot this person into, rather than trying to look at it from the patient's point of view and what's in the best interest in terms of longevity and in terms of quality of life. It's something to be aware of as another behind-the-scenes incentive. We've sort of listed some of these behind-the-scenes incentives in terms of protecting from liability, financial interests, fulfilling the doctor's calling, the doctor being comfortable doing what he believes in. And then in the university setting, that there can be a behind-the-scenes push towards getting people on a specific trial that might be very advantageous for some people, but inappropriate for others.
One of the factors that patients encounter is you have these doctors and you're having all these meetings, you're making all these appointments, and then, you're told, oh yeah, I don't have any side effects, or I get 90% of all my patients are going to get a cure. And how do you know that those are true and accurate? How can you do your research ahead of time? Because I think a lot of times, doctors don't always get that patient back to hear whether or not they are having issues, and they tend to go to a different doctor, maybe back to their family doctor or urologist.
Well, you've really pointed out a critical problem in this process of trying to get to the bottom of how risky is the treatment. How likely really are you to become impotent? And what is impotence? Is it just the ability to have intercourse, or is it the ability to maintain the same type of erections that you had before treatment? Those are two different things. So people oftentimes are not talking about clear endpoints. And then it seems to me even the finest doctors of the highest integrity are fudging the numbers. And this is because this question is asked, and I think there's little compromises made over time. And after the doctors have given these spiels, 1,000 times, the numbers get a little bit better each time. And finally, you get to the point, well, no one gets impotence. And it is a private thing, and so it isn't talked about afterwards. And I'm not sure I have a really great answer in terms of getting honest numbers. There'll be some of this in source documents, like in research, and maybe the PCRI, we can publish some of those outcome studies or give a link on this to point to this, because it's the question that should be asked, and patients should ask for a specific number. If I'm 65 years old and you do surgery on me, I like to have them ask the question, what's the chance that my function will be unchanged? Most of the doctors are saying, well, with pills, have intercourse half the time or something like would be an honest answer. But I think that many of the doctors are pushing the percentages higher than reality would dictate.
You know, in this video, we pointed out a lot of key factors that would actually kind of pose as difficulties for patients. It's a lot of work researching your doctor. It's a lot of work, you know, kind of coming outside of your bubble, advocating for yourself. I think this is why we always encourage people, if you can get somebody involved, have someone in the room with you, a caregiver or an advocate with you, call the helpline at PCRI, whatever you need to do to give yourself the confidence to pursue this. You know, and a couple other factors, it's like, as you're talking about, you know, all of this, we realize that the timing of prostate cancer, yes, they have time, but one of the things that patients don't always realize is that modern medicine, when it comes to prostate cancer, is happening very quickly. A lot of doctors aren't staying, you know, as up to date. And almost every doctor I meet has great intentions, and they're doing their best, but most likely they have, you know, 15 minutes per patient. They're racing towards the end of the day. We're in overloaded medical systems, and so it's really hard to stay up to date with the latest information and the newest indication. And okay, now you can do second-gen hormone therapy at the same as first-time hormone therapy. And so, you know, for patients having to do their research and advocate and say, well, I heard about this treatment, I heard about that treatment, it takes a lot of work. So getting somebody involved is really important. And I think other factors are like, as we talk about, you know, even side effect management, even following up with other patients who have had those treatments, because, you know, if you're going to hear, oh yeah, 90% of my patients have cure rates, okay, and they don't have any side effects, by the way. Hold on a minute. And even getting on forums and trying to find a patient who has had that treatment and following up even with the doctor. Great, you say that your patients don't have side effects. I would love to talk to one. Is that possible? Reading reviews online, seeing if there's academic papers that the doctor has published. All of these things can really add up to giving yourself a bigger and better picture. And I like how Dr. Moyad says it. He's like, you're always adding a piece to the puzzle, and eventually you get enough pieces that you can kind of put it together. Is this really the right treatment for me? And start to narrow things down. And so thank you so much for being here today, because I think this type of education is crucial for any patient who's trying to decide what to do and what the next steps are. A couple of other things that have helped when patients are going for second, third, fourth opinions is, as we mentioned, yes, bring a caregiver with you, but if it's not a partner, so maybe your spouse or your partner is not able to come with you, you know, other options are maybe your children or a friend, or even support group leaders from prostate cancer support groups have attended, you know, appointments with patients to help them kind of advocate for themselves or even just learn and gain information. Now, through this process, as you know, a lot of information is going to come at you all at once, and it's all new, and you're learning new words and whole new vocabulary, statistics, and all of that. So a great thing to do is to ask the doctor if you can record the conversation, and if not, at least get the notes. You know, as you take rigorous notes, get his notes as well, because a lot of doctors kind of do a written summary of the appointment, and asking for that can kind of help you track, you know, your notes as you take that home and you study. Another thing that patients don't often realize is you need to have your own medical records with you. You want to make sure to have your scans, your biopsy results, your Gleason grade, all of that ready, just so you can educate yourself. And then when you walk into those appointments, you can have that information with you. They can take a look at it, but it just helps guide the conversation, because the more you know about your specific type of prostate cancer, the more clarification you can get on the treatments available and the side effects that could possibly happen. Now, I know it's a lot just to have the courage to advocate for yourself, but these doctors in these modern times are getting used to it. A lot of patients watch our channel, a lot of patients across the board are advocating for themselves, and you want to find a doctor who has a disposition, who's willing to work with you and willing to have those discussions and explain the pros and cons, because this is your life. It's your quality of life, and your quality of life matters. And you know, as Dr. Scholl said, you do have time. You have time to focus on what would be the best treatment. You have time to focus on what the side effects would be. Think about about what you would do to alleviate or deal with the side effects through that process, and you also have time to choose your doctor. And even though it is overwhelming, I would encourage you, call our helpline, because they are prostate cancer patients who have been through this whole process. They can help discuss your case with you and kind of go through the individual treatments. But also, as you do your research, just continue to maybe put it all on one Word document or all in one place, make it simple for you, but write down your notes as you're thinking about it. I've seen patients kind of just keep an ongoing note on their phone, and as they learn something new, they write it down. And it's just very helpful to have it all in one place. We understand that this entire process is intimidating. And you may say, well, I'm just a patient. Like, how am I supposed to know more than the doctors? Aren't they supposed to know more? But as we mentioned, the medical system is moving quite fast, and doctors tend to be overloaded as they are in these medical systems. They're seeing a lot of patients, and staying up to date with new indications coming out every couple months is a lot. These doctors are incredible doctors. They want to help you. They're working with you. They've dedicated their lives to helping patients, and that is amazing. But we also want to remember just the reality of the system that we're in, and that you are important. Your health is important. Your quality of life is important. And we want to make sure that is emphasized as you go into deciding upon these treatments, and make sure that you feel comfortable with the decision that you're making. We want to make sure that you can eliminate treatment regret, and that if you kind of go back and you say, oh, I wish I had known this before, we would like you to know before. And that's the entire purpose of this channel. Please remember, most of all, you're not alone, and I hope you have a great week.